Hello, my name is Ella. I'll be your student nurse taking care of you this morning. Let's go ahead and close the curtains to ensure some privacy in the room. I'm going to go ahead and wash my hands for 20 seconds. So I see that you have a tracheostomy. That could entail a little difficulty in speaking, I'm sure. So prior to our procedure, I would like to establish a means of communication with you, if that's all right. Would you mind trying giving us a thumbs up to indicate a yes for us? Thumbs up, perfect. And a thumbs down would mean a no. Can you try that as well? Thumbs down, perfect. You did that well. All right. I just want to verify that your name is John Smith. Is that correct? Thumbs up, perfect. And your birthday is November 25, 2000. Is that correct as well? Thumbs up. Okay, thank you for verifying. All right, Mr. Smith, I'm here to go ahead and help have your trach area cleaned up. Have you had this procedure done before? You have? Okay, great. I'm glad you may be familiar with the steps, but I would like to reintroduce the procedure just so we're all on the same page, okay? I'll start off by using a suction catheter here. We're going to go down your trachea just to get rid of any secretion or mucus buildup that may have been hoarding down there. We'll also replace your inner cannula and give you a brand new one. We'll take out that old dressing and replace it with a fresh, clean one for you. And I'll take moments to assess the site and make sure everything is as it should be. And lastly, we have our trach stabilizer change. It would require a colleague for that, so we'll take care of that towards the end of the procedure, okay? How does that sound with you, Mr. Smith? Is that okay? Thumbs up? Perfect. And if you do happen to have any pain or discomfort throughout this procedure, feel free to let me know by giving me a hand up. That to me will indicate any type of distress you may have. I want you as comfortable as possible during this, so please let me know. And any questions or concerns you may have, I'm also here to answer them. I will be vocal in every step I take, so you're aware of what I'm doing at every moment. Perfect. Let's go ahead and go ask if you have any allergies. No allergies, thumbs down. Okay, good. I don't see a band here, but I just wanted to ask. And any pain right now? Thumbs down. Okay, good. Let's go ahead and take a look here at your vital signs. I see that your respiratory rate is a little fast at 23 breaths per minute, and your O2 sats are also a little low at 92%. Do you have any trouble breathing at the moment, Mr. Smith? Thumbs up, you do? Oh, okay. Any shortness of breath as well? Thumbs up? Okay, let's see what we can do and take a closer listen to your lungs then. Wash my hands. I also want to sit you up to a high Fowler's position that will help facilitate easier breathing. Sit you up. Perfect, thank you. Let's lower down your towel here and your gown. I just want to take note that you're using your accessory muscles to kind of help with that effort in breathing. So you sure may be struggling a little bit. Let's take a listen then. Breathe in and out as I say, okay? In, out, in, out, in, out, in, and out. Okay, Mr. Smith, I do hear some gurgling sounds. That could indicate that we do have secretion buildup in your upper airway, hence why you may be in respiratory distress right now. I'll take a moment to prep our supplies so we can prep you for suctioning, and that will probably relieve your symptoms and have you breathing a little easier, okay? Is that okay with you? Thumbs up? Okay, thank you. Wash our hands. And then we're gonna take a moment here to disinfect our table or workspace for 30 seconds. Thank you for your patience, Mr. Smith. Are you doing okay? Thumbs up? Okay, good. Almost about done here. Okay, last fit. Okay, that was 30 seconds. Let's wash my hands. Okay, Mr. Smith, while we let our table dry for 2 minutes, I want to take note of emergency supplies and make sure they're at bedside before we get started, okay? So I note that we have 2 trach sizes available, one the current size, which is a size 8, and a size smaller, size 6. We have also an extra inner cannula. Let's check our tubings here above you, if you don't mind. We have an ambu bag connected to the wall for oxygen with proper tubing, turned on at 100% rate with 15 liters per minute. And that's what 100% is for us. We're testing the function of our ambu bag, which is properly working. We have our O2 source here connected to the wall for oxygen as well at 4 liters per minute per doctor's order. Last here is our suction canister. It's also turned on at a regulatory setting at 100 to 120 milligrams of mercury for pressure setting. And then we have our catheter also connected. I note here that it seems to be used already. Let's go change that out and get you a fresh, clean one, okay? Changed out. Okay, Mr. Smith, we have a clean one for you now. Let's go ahead and prepare our work supplies since our table has dried. Wash my hands. So what I have for us, Mr. Smith, is a trach care kit. We have an inner cannula. We have a sterile disposable box, our sterile saline, and our trach stabilizer I'll put off to the side for now. We'll be putting that to use later. Let's open our trach care kit. We have a pair of sterile gloves. We won't need them. Let's dispose. We have a sterile drape here, Mr. Smith. Let's put this over your chest, just in case I happen to drop the inner cannula. We won't make a break in sterile, and we're keeping it safe. Beautiful. Let's drop our inner cannula. Perfect. We have our sterile saline box. I'm going to open up our sterile saline and pour halfway into the box and the rest into our tray. Okay, our supplies are ready, Mr. Smith. Go wash my hands again. So as I mentioned, Mr. Smith, your O2 sats were a little low. They were at a 92%. So I want to give you a couple of breaths so we could raise that up and have your O2 sats higher to prep you for suctioning. How does that sound? Okay. Is that okay? Thumbs up? Okay. And are you doing okay, Mr. Smith? Okay. Thank you. Let's go ahead and stabilize. I'm going to grab our amble bag here. And I'm going to give you a couple of breaths, okay? 1. Another one. Last one. Okay, great, Mr. Smith. How was that? Are you doing okay? Any pain? Thumbs down. Okay, let's replace your O2 source. I just want to note that your O2 sats did go up to 98%. That's exactly where we want to be. We're in a good spot, especially as we start suctioning. So I just want to give a fair warning that it might feel a little scary. I am technically putting a probe down your throat, trying to clear out those secretions. You might feel a little uncomfortable and induce you to cough. I just want you to relax. It'll be a quick 10 seconds. And I'm sure you'll be feeling much better as soon as we get those secretions cleared out, okay? Take that out. Let's go ahead and test the function of our catheter. Okay, it works. Okay, Mr. Smith, I'm ready for you. Are you ready? Thumbs up. Okay. We go in for 3 seconds. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7. Okay, Mr. Smith, how was that? I know that might have been a little uncomfortable for you. Okay, but you did well. Let's replace your O2 source. Okay, Mr. Smith. Do you think you need more suctioning? Thumbs down. Okay, yeah, it seems that your gurgling sound kind of went away. And I do see that the secretions in your canister here seems to be normal white clear sputum color. No signs of infection, so we're looking good. If you did need more suctioning, I would require a 30-second wait time just so you wouldn't overstress you. And I want to note that your O2 sats remained at a 98%. Your respiratory rate also lowered to 17 breaths per minute. So you are within normal range. If you did have lower sats for your O2, I would require to bag you, give you some more breaths so we're at a stable level. How are you doing, Mr. Smith? Thumbs up. Any pain or discomfort right now? Thumbs down? Okay, good. Let's go ahead and get started on changing your inner cannula. I wash my hands. And I just want to bring up our drape here. Like I said, it's a preventative measure. Beautiful. I'm going to change out my gloves again just in case. Okay, Mr. Smith. I want you to take a deep breath in for me. As soon as I take it out, I'll replace it back with a new one, okay? Okay, 3. 1, 2, 3, breathe in. How is that, Mr. Smith? You okay? Any pain? Thumbs down. Any shortness of breath? Thumbs down. Okay, good. You did well. Okay, we'll replace our O2 source later. I want to take a moment to assess the site. I see that there's no redness, swelling, or drainage around the stoma, no signs of bleeding, no signs of infection, no signs of skin breakdown. I want to note that the trach and the stabilizer itself are intact, no signs of cracks, no damage. And your tracheostomy is in proper position and good placement. Okay, Mr. Smith, you are doing well. Let's go ahead and get you cleaned up. I have a moisten swab here. We'll go under the faceplate. We'll also go on top. We'll moisten this. Go under. Moist this and on top. Sometimes some secretions could plaque onto your faceplate, so I moisten this as well to get rid of that. And let's dry the whole thing up now. And lastly here, I have our split gauze. Let's do our best to put it on. Mr. Smith, almost done here. Sorry for moving your head. Okay. Alright, Mr. Smith. Let's replace your O2 now. How was that, Mr. Smith? You did okay? You're doing okay. Thumbs up. Good. Any pain, discomfort right now? Thumbs down. No. Any shortness of breath? Thumbs down. I want to note that your vital signs are in a good position still, 17 breaths per minute per respiratory rate, and your O2 sats are 98%. I don't see any use of your accessory muscles in breathing that anymore, and I don't hear any gurgling sounds. Do you have any questions for me right now? Thumbs down. Oh, okay. Well, last step is your trach stabilizer change, so I would require to step out and get a colleague for that, but let's clean you up and dispose of my materials. And I want to wash my hands. And I'll take a moment to go ahead and lower down your bed to the lowest bed position. And here's your call light, Mr. Smith. I'll be right back, okay? Hi, Mr. Smith. It's Ella. I'm back. I'm here with another nurse colleague to help me with your trach stabilizer change. We'll both wash our hands for 20 seconds. Myself and the second nurse will both wear gloves. So before we proceed, Mr. Smith, do you remember how we say yes? Can you give me a thumbs up? Perfect. And a thumbs down will mean no. Remember? Thumbs down? Okay, perfect. And I just want to re-verify that your name is John Smith. Is that correct? Thumbs up. Good. And your birthday is November 25, 2000. Is that correct as well? Thumbs up. Perfect. Okay, Mr. Smith, this is something I never want to do alone. I always need a second person to do this with me. We want to be extra cautious, especially we wouldn't want moving things we wouldn't want moved. So we'll start off and take out each side of the stabilizer one at a time and go from there, okay? Okay, we'll have the second nurse stabilize the faceplate as I remove this side of the stabilizer. Second nurse continues to stabilize. And I'll take a moment here to assess the site of the skin at the neck, that there's no redness or irritation, and it seems to be also dry and intact. We do this one side at a time, Mr. Smith, to be extra cautious, okay? Second nurse continues to stabilize the faceplate. First band has been placed. Now I will stabilize this side of the faceplate while the second nurse will remove this side of the stabilizer. The second nurse will also take time to assess the site and see if there's any redness or irritation, with which there isn't, and any signs of skin breakdown, and the skin seems to be dry and intact. I continue to stabilize this side of the faceplate while the second nurse will put on the second strap. Okay, we will both check the sides of the stabilizer and make sure there's still a 2-finger length between each side to ensure that the stabilizer is not too tight. How is that, Mr. Smith? Are you doing okay? Thumbs up. Great, I'm glad you're doing well. Any pain right now? Thumbs down. Okay, good. We'll both remove our gloves and wash our hands. Thank you, second nurse. We'll leave you to it. Okay, Mr. Smith, before I go, I just want to make sure if you have any questions for me. Thumbs down? Okay, good. And I want to just do a reassessment on how your vital signs are looking. I see that your respiratory rate remains at 17 breaths per minute, so that's good. Our O2 sats also is still at 98%. It is within normal range. And your accessory muscles don't seem to be in work right now, so it doesn't seem that you have any shortness of breath. Do you have any shortness of breath? Thumbs up? Okay, good. And I just want to wash my hands again for 20 seconds. I want to take a re-listen of your lungs if that's okay. Okay, let's lower our gown here. Breathe in and out, in, out, in, out, in, out, in, and out. Perfect, Mr. Smith, look at that. Your lungs seems to be clear, equal, and bilateral. That means the secretions were all out. So before I leave, Mr. Smith, I want to make sure that the emergency bedside equipment is here, which is good. We're all checked. And to be a nice nurse, I'm going to change out your suction catheter so it's not yucky, and it'll be fresh and clean for your next time. So that's changed out. I'm going to leave your call light here and put you in the lowest bed position. I'll wash my hands again. You have a great day, Mr. Smith. Thank you for letting me take care of you. Okay, I've left the room. I will now document the necessary information of the procedure. I will document the date and time of the trach care. I will note that the patient tolerated the procedure well with no pain. I will note that the assessment of the stoma has no redness, swelling, or any signs of infection or breakdown. The materials also with the trach and stabilizer are clean, dry, and intact. The sputum in the canister, I will note the color, amount, and consistency, which was thin, clear, and white secretion in a moderate amount. I will note the vital signs were within normal range. O2 sats were 98, and respiratory rate was at 17 breaths per minute. There was no shortness of breath, distress, or coughing after care.